there. Welcome to the Pelvis Project podcast. I'm Megan.
And I'm Roxy. We're two pelvic health experts brought together by passion for our careers, entrepreneurship, motherhood, and the desire for intentional relationships.
Join us in our mission to spread pelvic floor awareness and start conversations surrounding the truth behind genuine health, imperfect wellness, and joyfully navigating life. We are so glad you are here with us.
Let's start the conversation.
Hello.
Hello.
We're back. And funny enough, we were actually together to record this episode. So Roxy and I are doing a continuing education course this weekend and figured we would also record a podcast. So here we are.
Nice to be here.
Okay. Well, today we are going to talk a little bit about perimenopause and something that I am personally kind of experiencing myself as being 42. This topic, is something that women are learning about, but it's just not a lot. We aren't taught a lot about perimenopause. And I think what we see happen in the clinic is we're capturing women who are kind of in this transition that it hasn't been kind of identified yet that the symptoms they're experiencing could be related to perimenopause. So I definitely think it's really important as pelvic floor therapists that we have an awareness of perimenopause symptoms. We are informed and the hormonal changes and how to talk to patients about all of this stuff. And so as a clinician, I encourage somebody that's in this space to take some courses surrounding this. And then obviously as a patient, if you're in the age category of, this can start in your 30s. And if you're feeling like maybe there are some things that are being missed, just reaching out and making sure that you can have a conversation with somebody that does have some training in this topic. So we can jump on in and start with what is perimenopause, really. So perimenopause is the transition that's leading to menopause. And this can start in your late 30s or 40s, and it can last years or months. And it can be where you might have symptoms for a little bit, and then they might go away. So this is the hormonal shifts that take place as we age, and the hormones become less predictable. So, for example, just using personal experience here, I'm 42, and there's some things that I experienced that I probably wouldn't have caught as perimenopause if I wasn't working in this space. However, luckily, I do. And so I was like, okay, this isn't cool. But some first indicators were my cycle was always very much regular at 28 days without birth control. And I started to have cycles that were 24 days, and then I'd go back to 29 days, and then I might have like a 26 day. And although those cycles are within normal limits and not necessarily, bad, it was a change for me that was happening. Along with, I started to eventually, I'm typically a really good sleeper. I started to have difficulty with sleep. I had more anxiety. I felt like I had brain fog, and fatigue levels were increasing. And I also have some other autoimmune things. And so it was difficult for me to navigate like what was what with that. And luckily I have some good providers and then obviously good friends and education to know, okay, let's kind of look at this and see what we need to do. So at 42, I already am having some interventions in place, and I'm not waiting until I'm, 47 or 48 when this gets really bad. And so those were just a few of the symptoms. And then of course I did have some changes happen. I just noticed a little bit more vaginal dryness and a few other things. So anyway, we have this, like we said, your hormones become less predictable. So you have estrogen fluctuations, you have a progesterone decline, your nervous system becomes more sensitive, and inflammation and recovery starts to kind of change. Another little tidbit that was interesting for me here recently was I had my yearly appointment at my functional medicine clinic, and they did a pelvic ultrasound, which they do every year to look at your ovaries. And I actually was like right at ovulation, and I had multiple follicles on both sides. And she was like, this is why in your 40s, you have increased risk for multiples because your hormones are like, it's less predictable. my body's trying to pump out. It gets higher amounts of hormones out at one point, another time it's less. So I thought that was really interesting. I'm like, oh, no wonder I'm feeling this way. So, but symptoms women often don't connect to perimenopause are anxiety, rage or irritability, insomnia, heart palpitations, brain fog, joint pain, fatigue, reduced stress tolerance, and weight body composition changes. So those right there, they often get overlooked. And it's like, now I'm hoping now we're having more conversations about this, but it is when I have patients come in and are telling me these things, depending on their age, I'm giving myself a little note that I need to kind of track these things and maybe start the conversation and dig a little bit more into what's going on hormonally. And guys, we're also seeing a lot of disruption in hormones from birth control. And I'm also seeing women in their 20s that have no progesterone, that on paper they look like they're in menopause. So I think that we have to remember that just because of someone's age, we need to be taking into consideration what's going on hormonally and what's going on with the endocrine system, because just like if you're a cardiac patient, yes, very rarely do we have cardiac issues in our 20s, but it happens and we need to not overlook it. It's the same thing when it's coming to our hormone health for females in their 20s also. So many women think that they're failing somehow during this time when really their physiology is changing. So you're often thinking you need to do more, work harder, something's going on. Like you start to think that you're doing something wrong, but literally your body is changing and we need to come in and help guide and find support to optimize it.
Yeah, I think those are just even just looking think you're hearing that list, it's like, man, those fly under the radar so easy. And just with life and even that season of life, which we'll talk about later, but I just think I want to affirm anyone who's maybe like, oh, that's a lot of symptoms. And that's also not saying a lot. Like there's not really obvious things that jump out to that, but just appreciating, okay, how old am I? How are things going? And am I noticing these things? So anyway. What we want to kind of shift into or segue into is then just the nervous system and stress, like the nervous system and stress load. And we've talked about this quite a bit on our podcast if you've been listening, but and we're not going to stop essentially because we're seeing it overlap in so many things. And so if we consider that the estrogen is, where Megan just hinted on, there's estrogen fluctuations. And so then as we appreciate that those changes, there's going to be spikes, there's going to be dips. But estrogen, from a zoomed out position in a broad statement, estrogen supports brain function. It's going to support serotonin, tissue health, our ability to recover, the nervous system regulation. Know that estrogen receptors are in every organ system in the body. And so these are the big ones here that we're talking about. But this can be, your skin. It can be, sleep, digestion, all the things. Not just like the sexual and reproductive side of that. And so fluctuating hormones is going to make stress feel greater because of what we just touched on there. We really want to think about like perimenopause isn't going to cause weakness. It's not going to cause these things. It's appreciating that it changes the margin, it changes the tolerance that we have for these fluctuations during these stress and recovery periods that we used to be a lot more resilient through because we had maybe a little more rhythmic cycle. Our estrogen load was higher. And so we have to give grace to the body during this, that just the sensitivity, the margins, that, the tolerance load is going to be less in these areas. And so what we really want to think about is how can we optimize this, right? So Megan hinted at, and she'll continue to speak into this because she's living it real time. But there's interventions we can go, and our providers are helping us with, and we're doing things on that front. What I really want to bring some attention to right now is just what are practical things we can be doing to try to minimize these spikes and dips. And so what that can look like is like sleep prioritization, strength training, protein intake. Are we eating whole foods? Are we optimizing the protein side of that? We know the evidence is showing that. Are we helping our nervous system regulate, or are we just running 100 miles an hour and never having that recovery season? Do we have boundaries? Are we resting? Are we saying yes to everything? Are we feeling the weight of what this season of life brings on us? And then we really want to think about that all or nothing wellness thinking. That's a big pillar that we stand on this podcast, is that imperfect wellness, and thinking, do we have to be perfect in our wellness, or just saying, oh, we're going to find balance here. And that might not look perfect. And we have to really release those expectations that maybe we've placed on ourselves during this season.
Yeah. Yeah, it's so true. Yes, all those practical tips are things that I myself are personally actively working on. And I had my body got to a point where I kind of had to. It was like a non-negotiable of these things that you no longer can survive on maybe some of the habits and schedule that you did prior to your hormones fluctuating and changing and evolving. And I think that we give it, it's like, oh man, you give this kind of a bad rap, but really, if you can embrace it and really realize, like, oh, these are things that we need to be doing anyway. Yeah, it's challenging because it's a change, but it can also be really remarkable in how it changes you. And I could go on and on about that, but yeah, I'm thankful for every change that has happened and everything that I've learned. And of course, there's things that are frustrating, but the more you educate yourself and the more you can give yourself more grace around it. So, next, we're going to talk about the pelvic floor changes that no one really kind of talks about during this time. So, explaining estrogen's role in pelvic health. So, estrogen supports pelvic tissues, bladder, urethral lining, collagen, elasticity, blood flow, and lubrication. And as our hormones fluctuate, tissue may become more sensitive, urgency and frequency can increase, leakage may appear, prolapse symptoms may become more noticeable, and sex may become uncomfortable. So when you hear us say that, there can be many reasons why these things happen. But we have to make sure that hormones have a place in the conversation, because if it's not, it would be like going to, I don't know, the eye doctor and skipping part of the exam. And if we're not talking, or at least having considerations for the hormonal role of why something could be going on. Okay. So, symptoms to highlight in a little bit more depth. So, with bladder, we could have like urgency, frequency, leaking with exercise, waking to pee at night, recurrent UTIs. Hormones can play a role in that. However, we see this get fixed many a times, and hormones are not playing a role in it. So I just want to make sure, again, we're reiterating that. In the pelvic floor, we might have heaviness, pressure, pelvic pain, tension, clenching, difficulty with relaxation, constipation changes. Again, that can also be happening without hormones influencing it. However, if we want to go down the deep dive rabbit hole of root cause and spending time looking at everything, chances are there's some sort of tension, clenching because of nervous system. Okay, what's your nervous system doing? It can kind of lead us down a path where, like, all right, we should probably have everything looked at. Now, again, depending on your age, depending on other symptoms, it may not be the case. And then for sexual health, dryness, pain with penetration, lower libido, and tissue sensitivity. Anytime with sexual health, anytime anybody's listing off symptoms or I'm asking questions, I'm keeping the hormones in mind, because again, even young women who are on birth control, that's affecting estrogen. And we may not think it, but we see vaginal dryness all the time. Now, there's non-hormonal options, and we go through those because I do think that that is a priority and an important piece. But it is, again, as a pelvic floor provider, we have to have the education and the awareness of what other options could we use and what could be driving these sorts of symptoms. So there's an important distinction of not all pelvic floors become weak. We've talked about this before. We can have weakness, we can have overactivity. This could be because of stress, it could be because of numerous things going on. And you have to remember that with what we're doing, that's why we're trained to do the assessments we're trained to do, is to figure out exactly what's going on, because there's nuance in it.
Yeah, I think just as we're considering, the hormone piece can exaggerate what maybe is happening outside of the hormone piece. And that's kind of
Mhm.
how, when I'm working with people, and that's what you were saying earlier, just it's not necessarily that it's only one area that's causing. I think we imagine what's fueling and we see this increase in symptoms that maybe would have been there anyway, but the hormonal piece during this perimenopausal season definitely increases and exaggerates and worsens those symptoms. So let's then pivot here a little bit and talk about the movement, the exercise, the recovery, like what maybe we used to do isn't working right now. And I think that this is a time that we can really build this skill set to say, okay, what happened 10 years ago even isn't working for me now. And that might be the case even 10 years down the road. And so I think this is just a good way to invest in ourselves to say, okay, let's work on being resilient. Let's work on pivoting and still meeting our goals. And so thinking about recovery changes aren't going to be the same. Our cortisol and our stress load, that's going to ebb and flow, and we're going to have more resiliency or less resiliency through that. Sleep disruptions are going to change. Overtraining can start to occur. If what we were trying to do earlier in life is what we're trying to do now, then we definitely see the effects of that. And then also during the season, we're having muscle mass loss, for example, where what worked then doesn't always work now. And so instead of like pushing harder or doing more cardio or really getting in the weeds of like, let me just do more. Let me push past some of these symptoms we're having. We really need to shift towards this idea of like strength training in a level that serves our body and we have appropriate recovery. We will also then need to look at mobility. If we're trying to strength train and our body is tense and stiff, then that's going to set us up for pain and injury most likely. We also need to be emphasizing recovery a lot more. I don't know about you, Megan, but I have a bad habit, and especially I used to, of just like putting my shoes on and going and doing my workout and then being done, hopping in the shower and whatever. It's like, no, we have to be warming up. We have to be cooling down. And then we also have to see how does our body feel the rest of the day or into the next day from that. We shouldn't just be mindlessly exercising anymore, even if we got away with it earlier in our life. And then really noticing the consistency. And are we just dumping a lot on our body when we're feeling motivated and then we're tanking later on, maybe in our cycle or when stress load increases? And then really supporting the nervous system. And so really thinking about from a pelvic floor standpoint, we're really going to emphasize the breath mechanics as a mobility strategy and a nervous system regulator. Also thinking about pressure management so that we're recruiting the correct muscles and we're helping our body build resiliency through day-to-day activities. And then using leakage as an information, not necessarily failure, to say, oh, what's going on here? And how can I, let's be curious about that. How can I then pivot rather than feeling like we're just failing in life? And then not fearing movement. A lot of times when these changes are happening, it's easy for us as females to kind of recoil or to just stop and freeze kind of and just do whatever the least amount or avoid completely. And so we really want to kind of press into these symptoms in a healthy way and try to figure out what is my body able to do or what triggers it, really glean information and not be afraid that exercises like that part of my life is over, because that's actually a big fat lie.
Okay, so what women actually need during perimenopause? I mean, obviously, there's lots of different things, but let's just chat a little bit about medical support that matters. So, we really encourage that you ask a lot of questions. If your provider brushes you off, find another provider. Okay. So, asking a lot of questions, maybe having a pelvic floor assessment or having a pelvic floor PT that you get an assessment from, and they are kind of part of your healthcare team now. It might be that you're doing just fine and you're in that perimenopause phase. You want to go ahead and have an assessment, you want to get educated, then you're going to go about your business and they're there for you to be able to pop back in and see and be like, hey, this showed up or that showed up. Hormone conversations, obviously, like I just mentioned, and finding informed providers. So that means finding informed providers as pelvic floor therapists, finding informed providers that would be your GYNs or your, primaries, ones that have done, some recent training and are open to having conversations about hormones and the changes that happen in the body. Some women have mild symptoms and others struggle significantly. So for me, at 42, I'm having changes where I'm having to step into using hormone replacement, where other women are doing just fine until they're in their late 40s. So that's where it's just different for everybody. And I think that that is, I mean, obviously, that's a good thing that it's different for everybody because we're not all made the same. And then another little something to think about is I just recently, this kind of came up. I just want to encourage everybody that if you had a hysterectomy, let's say 5 years ago, and you left your ovaries and they were like, you're great. You have your ovaries. We don't need to be doing any hormones because you still have your ovaries. Well, let's just remember that 5 years later, your hormones can change, your hormones will change also. So it's really easy for us to just think like, oh, that was just yesterday when I had that done and I still have my ovaries, so I'm good. Time goes by really fast. So keeping in mind that if you've had a surgery, you still need to stay up on top of your appointments and these conversations because you too are at some point we need to be having this conversation, obviously. But overall, things that can help that matter, and Roxy has talked about this. I feel like now we've reiterated it, but during this time frame, exercise is great, strength training, sleep, stress regulation, hydration, protein and fiber, pelvic floor assessment, vaginal estrogen discussions with providers, social support and community, maybe other forms of hormones that you might need to have assessed, like progesterone, testosterone, those sorts of things. And if you are also having some contributing other factors going on, other health things, this also can look a little different, or some of these are going to be at a higher priority list. And with stress regulation, that's not just like, okay, I need to calm down. There are some really good strategies that you can start implementing into your day. And I like to tell everybody, 5 minutes is enough. We often just blow past if we have 5 minutes. We don't think we have enough time to regulate, and we do. So could do a whole podcast on that.
All right. Well, thanks for that. We're just going to kind of close out here with just a nugget to think about. And so, a lot of times when this starts to happen, the mentality that goes through or the thoughts that go through our mind are, okay, it's the beginning of the end. We're like, it's all downhill from here. This is, where my life changes. Let's look at it more as a transition. And we really need to appreciate the information we can glean about this part of our life, about this transition. What support do we have to support us through this transition? We need to be having self-compassion and, quite frankly, just better conversations so that we aren't feeling like we're alone on an island, or that the symptoms that are happening are now permanent forever, right? There's so much that we can do to still optimize the body. And so women, we've often believed that we just need to tolerate symptoms quietly, that this is just part of life. But many of these changes are treatable. They're definitely manageable, and they're absolutely worth paying attention to. And so really thinking about, rather it being the end, it's a transition.
It could be the beginning of something really great if you embrace it. All right. Well, hopefully this is helpful. And if anybody has any questions or wants to have a consult with Roxy or I, please reach out to us. And until then, we'll keep the conversation going. Thank you so much for joining us this week on the Pelvis Project podcast. Help us continue the conversation by liking and sharing this episode with friends. And if you really want to do us a solid, leave us a review. If you'd like to follow us on social, check out the show notes for links. And remember, this week, take a deep breath and relax your pelvic floor.